thank you for joining our Under the Hood of Women of Perimenopause event. I'm so excited. This is such an important topic, and I'm just looking at Laura right now, who is pretty instrumental with the team in terms of getting Perimenopause Awareness Month um, as a thing. And so it's Perimenopause Awareness Month, and we're so delighted to be having this conversation and really talking about, the differences in different stages and phases of menopause and the importance of it. So I just want to say thank you all for joining. I'm Elizabeth Elfenbein, the founder of Under the Sisterhood, and we are a story sharing company. We are a social impact organization that is powered by intergenerational stories. And we use these stories to inspire action and to educate. And this is a great example of that, how we bring women together. We gather at these events. You're all experts at what you do. You also have lived experiences. And we look at the cumulative factor of all of that. And Jackie talking to Dr. Tracee, talking to Shubhra, talking to Amy, talking to Laura, talking to Myra, the continuation, the connectedness of all of our journeys is not just universal, but it's really, really helpful in understanding that you're not alone in this. So welcome. Today, I'm going to get right into the conversation and start introducing this incredible lineup of panelists. And I think what's great to understand is these are women who are focused in this perimenopausal phase. So the expertise, the desire to really understand and to help educate and empower everybody in the room and beyond, and empower each other, because you might even be an expert at it, but there's always more to learn. So I'm going to start with I'll introduce every single one. The one thing I did want to also say is that, and we'll get into this with our experts, of course, but I want to say one thing. Like, if I had known what I know now back when, when I was going through perimenopause wasn't a thing. There wasn't a word for it. And we just went through it, and we had all these different symptoms, and we just sort of marched on with life and endured. We raised our kids. We had big, high-powered jobs. We did everything we had to do, and we didn't consider it. And what I love about what's going on now is giving voice to, it's sort of like a revolution in a way, and giving voice to women in a way that helps future generations, like my daughters, will know that they can take the space, they can make their voices heard about this, and that their symptoms are real. They aren't, fictitious, if you will. So anyway, I'm going to move on and get right into our incredible panelists. Tonight, we have 4 incredible women in the perimenopause space and of course, beyond. We're going to start with Laura Okafor, and I will introduce her. She's the founder of Peri, a digital wellness platform dedicated to supporting women through perimenopause with evidence-based guidance and holistic resources. Laura is also a recognized advocate for the perimenopause awareness, having established the Awareness Month together with the National Menopause Foundation. So I just want to say kudos to you on that. It's amazing. This is such an important thing because, again, I look at educating women who are going through it, but I also look at future generations. And so my first question to kick off the conversation tonight is, can you share your personal experience with perimenopause and like how did it, how it led you, that inflection moment to establish Peri?
Yeah, absolutely. Thank you, Elizabeth, for creating this space, and thank you for bringing us all together. And happy Perimenopause Awareness Month. For me, and we once talked about it, it was very much a gray zone. So I'm in my early 40s. I have 3 small children, and it was for me really the gray zone of being in postpartum and experiencing first perimenopause symptoms and being very confused by what is what. And how it manifested for me really is more through the emotional health angle. So heightened anxiety, disrupted sleep, just being very irritable and not being able to explain why, in a time which, you should find enjoyable and, not be as anxious as I was. And that's really what we're trying to do with Peri, is to shine a light on this really gray zone, especially perimenopause, late 30s, early 40s, where we see in our community women being dismissed the most with their symptoms because health professionals maybe not be able to read the symptoms, may dismiss it as being too young or, not understanding the symptoms as perimenopause. So yeah, that's my story that really led me to, create that group and create the community, because as you're saying, Elizabeth, it's really important to have that peer-to-peer interactions, to have the validations that you're not the only one who's going through that. And that's what Peri is all about, really creating that community safe space.
That's wonderful. I think what's really fascinating, and of course we'll speak to everyone else in the room, but I think it's fascinating as women, we go through these journeys in life and, there's these inflection moments and they're either the catalyst to doing something about it or sitting. And so I really want to just say that I applaud the work you're doing with Peri. The Perimenopause Awareness Month is huge. And, what is it? Perimenopause Awareness Day on September 22nd. So I really applaud that and celebrate that. And I think bringing community together around these topics are so important because it does really help you understand that you're not alone in this journey. And then also you'll learn about what other people are going through, which might be aligned to you, but you might also learn some new things. We're going to move on, if it's okay, to Dr. Tracee Burroughs. Gardner, and Dr. Tracee is a committed professional in the fields of medicine, science, and psychiatry. She's a board certified psychiatrist, and she serves as the chief executive officer, the CEO of Urban Behavioral Associates, and then the creator of Urban Wellness Society, which is her midlife wellness coaching practice, which I think is wonderful because I'm sure you're seeing so many things. And I'm curious, Dr. Tracee, in your mental wellness coaching practice, like what are the trends or challenges that you're observing in women experiencing this phase of life, the perimenopause phase?
Sure. And first, let me echo Laura's sentiment in thanking you for creating this space for us to come together and talk about this. I think you're 100% right that while we've known the word menopause for many, many years, and even that's been poo-pooed, we're really starting to pay attention to this pre-menopausal, perimenopausal space. So thank you for bringing us all together. And I'm seeing exactly the kind of things that Laura was talking about, not just in my coaching work, but also in my psychiatric practice. Women are coming in and they're like, Dr. Burroughs, I have no idea what's going on with me. I am losing my mind. People are getting emotionally hyperreactive. I'm crying for no reason. Everyone's pissing me off and I'm not sure why. I can't sleep. I'm hot all the time. I'm sweating in the middle of the grocery store. True life story. And everyone thinks I'm losing my mind. Is it me? I've got ADHD. I can't remember anything. I don't know where my keys are. And I just need to figure out what's happening. And so half the time people were working with me anyway for depression and anxiety. So we just thought, maybe it's just an increase in those symptoms. But as I'm working with women and as I'm living through it and seeing my friends and family go through it, it's really clear that we're all going through a second adolescence. We're going through a second adolescence and we are trying to physically deal with those changes and then emotionally deal with not only the transition into this mid phase of life, but also the emotional ups and downs that are coming as the estrogen and progesterone and all those great hormones are going up and down. So it really is, everyone's on a mental roller coaster. Some people are on a little roller coaster and some people are on big roller coasters. And we're all just trying to navigate through that. So that's kind of what I'm seeing in my practice.
Thank you for that. And I love the mental roller coaster sort of analogy because you can imagine it, you can feel it. And I think that it's such I mean, perimenopause, this stage of life is such a feeling kind of stage. I do want to comment. I apologize for not introducing Dr. Tracee. She is one of our Women's Health Expert Council members, and we are very grateful to have you. And I'm sorry that I didn't incorporate that in. So yeah. But I think the reason why I do want to be sensitive to this as well is that one of the reasons in meeting Dr. Tracee and is understanding her experience in the midlife and having her own personal experiences, both experiencing midlife and the transitions and burnout, and being able to apply all of her psychiatry and her mental health coaching to support women in this category, in this life transition. So I think it's amazing. I hope I didn't speak too much about that. We're going to move on to Jackie Giannelli. And Jackie Giannelli is a board certified family nurse practitioner specializing in women's health with extensive expertise in hormonal health, menopause, women's sexual health, and urogynecology. And before I get into the question, Jackie has just joined our Women's Health Expert Council, and is doing. We just did an interview around sex span and getting under the hood of sex span. So I'm going to ask you the first question, which really connects the two, is can you discuss the concept of sex span? And it's important in the context of health, in midlife, if you will, and what practices you recommend for women enhancing sexual health.
Sure. Well, thank you for having me, Elizabeth. And, so excited to be joining this team. This conversation is, one I love to have because perimenopause is hard, menopause is hard, and women's sexual health is, embedded in that. And honestly, kind of comes up a little bit later after we've talked about our hot flashes and our mood changes, and the patient's like walking out of the room and their hand is on the door and they're like, oh yeah, and about my libido, right? And at that point you're like, okay, well that's a whole other conversation to have, and it deserves its own time and its own space. So sex span is really the confluence of women's sexual wellness and longevity science. We think about, there's lifespan, which is just simply stated the number of years that one lives on this earth and is alive. It does not mean that we are in good health. It just means that we're living. And then there's health span, which is what we're all trying to move towards more, which is that I think women in particular also really don't want to live forever. We just want to live as many good years as we possibly can and then take me out, right? So health span and really tracks right along with sex span. And I think about sexual wellness really as one of like the KPIs in business speak of, of your longevity. And it is, yes, it's a vitality marker or vitality metric, but it also is a signal. It's an indicator of our cardiovascular health, of our mental health, of the way our nervous system is functioning, of the way our pelvic floor is functioning. And we've really reduced it. It's really just been kind of an afterthought and just sort of a, well, if I get around to dealing with my sexual wellness, that's gravy, right? But no, it should be more embedded in the general conversation. And we need more providers who are literate in female sexual medicine. I'm also a menopause provider, so I'm certified by the Menopause Society, but I fell into that work through women's sexual wellness. And one thing that I loved about it was the intersection of mental health and sexual wellness, because those two things go hand in hand. But it's more than that, it's your cardiometabolic health. And we take that very seriously in men, right? When men have ED, we immediately, think about what that means for their heart health. And we don't do that for women. And it's high time, I think, that we start talking and researching and understanding how inflammation and insulin resistance and heart disease impacts women's sexual vitality. And so that's some of the work that I do.
Just a little bit of work. But I think it's really interesting the way you just described the interconnectivity of it all, mind, body, spirit. In a way, I'm putting it loose, but sexual health, if your mind isn't in a good place. And so I think that that's amazing. And also the fact that in a way, your lifespan, you're working, the lifespan or the continuum of women. So to look at that, a lot of us get so busy with life. You're right. We're not thinking about sexual health. So I think it's great that you're out educating and really just, rethinking all of us. I'm just sitting here looking at this panel of thinking about the concept of sex span. I'm curious, with all the people in the room, how many people have ever heard of that? Put your hands up in chat or think about it. But we're going to move on. But I think sex span's a very interesting concept that needs education. So thank you for that. Shubhra Sharma. Shubhra is the founder of Kriya Hair, a holistic hair and wellness startup that champions minimalist, life-affirming products designed for women at this stage, 40 plus. And her 30-year career highlights include empowering girls and women across cultures and economies by implementing literacy programs and in some of the most economically depressed and violence-affected regions of India within a decade. And I think the reason why Shubhra is a very interesting person to bring into the conversation, because she's going to talk a little bit about her own journey, but she also has this expertise and is a thought leader around aloneness. So I'm curious, and welcome, Shubhra. Can you share your personal experience with perimenopause and how it has influenced your professional journey?
Yes, thank you so much, Elizabeth. I'm always super excited to be part of this community of like really amazing women who are living life and learning intensely from it, like every day. So yeah, I think journey really starts with this very kind of a perfect storm. This is 2015. I had suffered a traumatic brain injury and then like two heavy like personal losses. And then menopause hit really early and hard. I remember just like a frozen shoulder, feeling really discombobulated, hair loss, just long. I had really long hair that was just coming off in clumps, and that sort of terrified me. And also periods that became very irregular. And so to me, that felt like a strange place to be in. One, because I had never really felt comfortable in my body as a woman, and because I had grown up with endometriosis, and so that was always very painful. So always almost living outside of my body or wanting to. And this sort of confirmed to me like I was in some kind of a strange little cave, if you will, and I needed to escape. And I remember sitting in my New York apartment and wanting to drive a knife through my heart. And that just stopped me so cold because I didn't know where that thought really sort of came from. Um, and I just sort of looked up and, one of my products was kind of sitting on the shelf. And at that time, I hadn't even thought about the connection between that and what I was experiencing. So I just said, like, why don't I just give myself a quick massage on the scalp and maybe try and sleep? Hopefully that'll help alleviate the symptoms. And that's what I did. And I went off to sleep for about 2.5 hours, and I woke up feeling kind of calm and a little bit happier. And so I had a solution to a problem that I didn't understand in that moment. So that's when my research really started, where I really began to try to figure out what was happening to me. And that led me to rebrand Kriya into, a menopausal sort of scalp and hair care for women, simply because of the way in which it had helped me, like really calm me down, and to also make the connection between scalp and hair care as wellness, right? That it doesn't have to be about, oh, I want to grow hair. No, but my body also is saying that you need to take care of me at the same time. So really thinking through some of these minimalist ingredients that, of course, my parents had created this, but I sort of rebranded it as menopause wellness. Yeah.
I think that, well, first of all, congratulations on that. I didn't know that quite that story about the rebranding.
Yeah.
But I think it's interesting because, I mean, the hair loss, one of the symptoms of perimenopause, and I'm curious again, how many people will have experienced that in this group will have experienced hair loss. So I think, I applaud you again. I think it's an interesting connection between you and Laura, who both have, as well as Dr. Tracee, who have both had things happen, these inflection moments in our lives that has said, hey, yeah, we've got to look at something differently. And so I think, it's fantastic that you created something to try and solve for that. And I think scalp wellness, like yeah, we all need, we need to feel that. So I'm going to move on to Laura again, and it would be great if anybody, start at the end. We'll have a Q&A, but if anyone has questions, you can start putting them in, and we'll at the end go through that. But Laura, what insights, you've created this Perimenopause Awareness Month, and what insights have you gained from your work in Washington while working and advocating for this month and the day? And how do you think that this initiative can change the conversation around women's health, not just perimenopause, but the broader?
Yeah, good question. We we founded Perimenopause Awareness Month last year for the first time. It was really, kind of this doesn't exist, it should exist. Menopause Awareness Month exists, which is great, and we need to pay attention to the little sister. That's why it's September. That's why it's like a month before October. We started last year, and this year we have now 15 states in the US already officially declaring it as a month, which is great. Yesterday, Texas just came in. I don't know if anybody's here from Texas, but this was big news. So yeah, so it's now an official month. So I think and on Monday, excuse me, we're going to DC, to Capitol Hill, to have a congressional briefing to, again, have more involvement on a state level as well. I think the learnings are still, that there is way too little research, and I think that everybody here can speak to it. Activations like this month and just bringing it in front of people and involving speakers like you're doing right now, Elizabeth. We have a series of speakers. We have online events, offline events. I think it's not all happening in Washington. It's really happening through events like this to create this moment and to create the urgency to do something. And that's really something we saw which works and which brings attention to it, also on a congressional level, to just, share our voices and make it, make it an activation, make it a month, and really through those engagements and through those conversations, shine the light on it. And we are surprised by how many states immediately said, yes, this is an official month in our state as well. So although women's health can be very controversial, I feel like that with midlife and perimenopause, there seems to be more and more understanding, no matter on which side of the political aisle, that there needs to be, more attention to it. And it's maybe less controversial than other topics. But to your question on women's health, I think this, it at least opens up the conversation for, I always call it like women's health 35 plus. It's not only perimenopause, it's really, what's happening to us, you know, after our 30s, after our 35th-year-old birthday. So it's really like, I think that's opening the gate on shining importance on that and having that through conversations in the community.
Thank you for that. I'm kind of curious, just like hearing you describe that. This is all new. I'm just listening into this conversation. And you're talking about Washington. You are based in Europe. And where are you based? And is this, is Perimenopause Awareness Month a thing in Europe? Is it global? And
No, yeah, it's fine that you're asking. So everything we're doing with Perry is really right now US based. I'm originally German, have German Nigerian. I don't know if you can hear it from my accent. I'm right now in Amsterdam. We started in the US, now here in the Netherlands. I have conversations already, everybody, there is such, also in Europe, there's such a wave of, women want to do something. So I'm sure next year in Europe, there will be more around this. The UK is, I don't know if anybody here is from the UK in this call, very much at the forefront of menopause and perimenopause. Germany, Netherlands, it's starting now. I would say, kind of UK, then the US started definitely a couple of years ago, and now the rest of Europe is gaining a bit more momentum as well.
That's first of all great news, and I love the fact that it's in the U.S. I also think it's very interesting, and I'm looking at all the women here. Is we're flipping the script really when we think about it. Menopause, and I know the M factor. There's all sorts of things menopause has been talked about, but what is it really? And Jackie probably will answer this. It's after 1 year of no periods, your menopause and beyond. Whereas perimenopause can be 3 to 10 years and can start in your early 30s. And so I think that understanding in a way, and it just occurred to me now that we're having this conversation, that it is changing the narrative. Like it's great that they're talking about menopause, and now we need to really amplify perimenopause. And so Dr. Tracee, how do you think perimenopause influences mental health and wellness, and particularly for women managing? And I love this, it's Superwoman syndrome. Dr. Tracee just did an Under the Hood of Superwoman syndrome, and so this is a space that I know is near and dear to your heart.
Absolutely. I could talk about Superwoman syndrome all day. But as we're entering into this kind of midlife space and our bodies are changing and our emotions are changing, our life goals are changing, our desires are changing, everything's changing. And so all of the responsibilities and tasks and everything we had on our plates in our 20s and 30s and into our early 40s even, it doesn't work anymore. And so part of the reason I do the work that I do is because a lot of us are just struggling. Yes, with the emotional turmoil that comes from perimenopause, the depression, the anxiety, the irritability, the physical changes that are coming from it, not just the sleep and the hot flashes, but the difficulty losing that last 5 to 10 pounds that would have come off very easily previously, the changes in sex drive and desire, both increasing and decreasing. And we're being asked to continue to do everything we had been doing before. And so that's where the superwoman syndrome piece comes in. We're still being asked to care for everybody all the time at the expense of ourselves. And we just physically, mentally, and emotionally are not in a place to do it the way that we used to. And so everyone's trying to figure out, well, what do I do now? And that's the frustrating part about perimenopause, but also the really, really cool part about this phase of life, because we get to reimagine what it is that we want to do, who it is that we want to be, and how we engage with our bodies and with the world. So I'm not quite sure if I'm answering your question. I hope I am. But that's kind of the really cool part as we're navigating through this phase, and hopefully taking that S off the chest, or at least taking it down a little bit. And Laura, to your point, I was just Googling while you were talking. My state of Maryland has recently adopted Perimenopause Month as of September this year. Our Governor Westmore announced it. And it looks like he's been working with your site. So this is awesome. And I'm so excited to see the work you all are doing.
That's amazing. And thank you for that. I was really compelled after our conversation to get under the hood of the Superwoman syndrome, because I think it starts, if we can actually even educate women in this group and beyond at the perimenopause phase who are doing so much and taking on so much, and recognizing what that means, combine that with the symptoms of, say, perimenopause and everything else that you're managing. It's like, wow, it's a lot. So I love that. It's great work. And thank you for sharing that. Jackie, I'm kind of curious, back to libido. What are some common changes in libido that patients report during perimenopause, not menopause, and how can women navigate these changes?
Yeah, like I mentioned, libido is one of the most bothersome symptoms of perimenopause. There are many symptoms of perimenopause, over 30 or 40 of them. I think we keep adding them. But libido is something that detracts from quality of life, and it impacts your sense of self and your own power and pleasure and confidence, but also your relationships, kind of how you show up in the world, and the physiology. We are dealing with a lot, as Tracee mentioned, in midlife. So it's the confluence of hormonal shifts, not just declining estradiol that certainly impacts our ability it impacts our brain fog, and impacts our weight and how we look and feel in our body, but also our testosterone has silently and kind of quietly been starting to decline, and that actually begins before perimenopause starts. So that can start for a woman in her late 20s, early 30s even. It doesn't fall off a cliff like estrogen does. It kind of slowly just kind of goes down. And in the postmenopausal years, we actually have more testosterone floating around than we do estrogen. And this is, meant to protect us long term. But what we're seeing globally, and this is in men and women, are just general declines in testosterone as a hormone. And it's impacting fertility, and it's impacting our heart health. And so it's something that needs more attention in women. But it is the kind of the base coat of paint. It's the thing that really fuels all the domains of our sexual functioning, libido being at the top of the list, but also our ability to experience arousal, which is the physiologic response, where you feel aroused, you feel blood flow, you feel sensation, you feel pleasure, and then the climax, which is the orgasm. All of those domains are impacted by testosterone as well as estrogen. So it's the confluence of hormonal changes, also stress. Certainly, we have to be in our parasympathetic nervous system in that rest and digest mode in order to be able to access pleasure. And women in midlife have quite a lot on their plate. Again, they're dealing with lack of sleep due to declining hormones, due to them, just having a lot to do. And this is, often when I hear women say, I want to want it, but I don't. And is that even a problem for me? Like, is that okay that I don't want it? I think we've really normalized this idea that everyone should want sex. And it's okay if it's not distressing to you to give that up, right? That's actually, there's a diagnosis called hypoactive sexual desire disorder, and it's predicated on this idea that it actually has to be distressing. So to normalize that, I think, is important as well. But we think also about sex as being for someone else. And I think when we reframe it also as being a pillar of health, that there are neuromodulators that are released, that there's nitric oxide that's released when you have an orgasm, when your joy is prioritized, it really grounds you in your body and it really sets you up to advocate for yourself in all aspects of your life. I think when we flip that script, that it's for you first, and you can own that aspect of your wellness, then it can become a tool in our toolbox that we can use to kind of, move through into the second phase of life.
Well, this is a topic, it's not an easy thing to talk about. It's really interesting. So to hear and talk about it so openly, libido and sexual health. And I think, you described this in the first answer to the sex spam, which was the fact that it's important for our overall health. I am kind of curious. You also made a comment, it's okay if you're not interested in anymore. If you're not interested in sex anymore, does that impact your overall health?
Um, Not necessarily. No. I mean, I think that there are there's not one way to do these things, right? There's not one way to be healthy, and you can improve your cardiovascular health by exercising, right? I mean, you can find joy in your female friendships, and that also releases oxytocin. So it's not the only way. Certainly, it's socially normalized to feel this way. But if it's something that was really important to you and was an important part of your relationships, an important part of your sense of well-being, and now it's gone and that's distressing, that's something that's really worth pursuing to try to get back. And that's always one of the foundational questions I ask is, are you coming to me, to improve your sexual health because this is something your partner wants you to do? Do you want this? And how did this show up for you in the decades leading up to perimenopause? Because all of that will inform how we think about, optimizing and the treatments we choose and the paths we go down.
Thank you for that. That's really that really is illuminating because it is such I don't want to say it's a taboo topic, but it's not really talked about. It's not as comfortable. So just to hear that other side of it is really great. Shubhra, I'm kind of curious, like what insights do you have about the feelings of, and I know this is kind of like a little bit, but based on some of your experience and the talks you're going to be doing on loneliness and aloneness and that many women face during perimenopause. So I love the connection of this because we can feel alone at many different stages, but perimenopause is very interesting in terms of an inflection point or a life stage, if you will.
Yeah, no, that's a great question. I think for me, really those events in my life led me to be alone. It was not sort of a choice that I had, right? It's a choice. It was sort of an unchosen wound, if you will. And I had to very quickly learn how to be okay in my aloneness because I think being alone is seen as exile or as emptiness. And I didn't sort of see that for me. I felt like here was my opportunity to really revisit with me, to really find a space of power, really through pause and not through like this performance all the time, where I could really see myself very clearly. I could retrain myself, right? And I could reclaim myself as well, right? And I felt that that to me was, as it said in my language, it's called Atmasat, which is your siding with your soul, right? It's not about your chosen role. It's right, what am I? Like in sort of the truest essence of it. And I think going through menopause and going through that perfect storm was an opportunity for me. And that allowed me to really think through some of the most critical things, right? Like how is normalization of female suffering in my own culture, right? Through which particular means is it normalized, right? Through popular media, through films, right? Where women kind of are seen tethered to the gaze of a man. And so if he sees it's okay, and if his gaze is circumscribing, her very existence, then how does she get to inhabit herself? Right. Also seeing my aunts and my grandmother and my mother all sort of in that phase of not really understanding what's happening to their body as if it is just normal, right? Plus the fact that if you've normalized suffering for women, they are never going to articulate anything, any kind of pain that they may be suffering through, right? So my grandmother got addicted to tobacco. My aunt has survived cancer twice. My other aunt, was always sort of bedridden because she had a compromised immune system. And this is just sort of the other part of the perimenopause that they never kind of understood. So it became really incumbent on me to sort of, as this woman who had this opportunity to not be tethered to any sort of cultural relationship, really figure out what is going on, like generationally. And so I think my last 10 years really has been an experiment in aloneness, right? What is it teaching me about myself? What is that siding with the soul look like, right? Do I feel empowered? Do I feel disempowered? What is happiness? All of these questions I think have come really hard at me. And eventually I feel like um, it's not about playing a certain role or being culturally inscribed to um, perform a whole set of roles as a woman, but really to choose how I want to live, right? And that choice, I think, to say that I have a choice is in itself empowerment, because many of the times, even at least women in my family were never given the opportunity to even articulate that. So for me, yeah, I think aloneness is a project that is ongoing. Yeah, understanding what that means.
I love aloneness. I connect with that. I like the concept of it. But I think what's very interesting about what you shared is your intergeneration. I want to bring this up because all of us, every woman in this room and men, we all have these intergenerations. We have this lineage and we came from these things. And, now we're in a position where suddenly perimenopause is a thing and it's being understood that we can pass down to the next generation. I mean, rest in peace, my mother's no longer here, but looking at what she went through, I was just having this conversation with a woman I was interviewing yesterday. I believe she's on the call, EJ, and we were talking, she's sharing how she wishes that she knew what she knows now back then, just be more supportive of her mother. So we're actually setting up a generational thing here. This is what I'm getting at right now, is that in a way, these conversations are setting up next generation. So as we move through, we go through postpartum, the next generation comes up, they have a better understanding. And by the way, the project of aloneness in the process of all the feelings we feel and the symptomologies, because I think that's what's interesting and kind of curious with everyone in the room. The thing about perimenopause, it isn't just the autoimmune diseases, the different things that come up to you as symptoms. It's also the emotional, the feeling of it all, the overwhelm. And so I think aloneness is a very interesting concept that needs to be, and I know that you're going to be doing your TED Talk, so thank you for that. Laura, we're going to move back to you. And I think this is great with all of your experience around menopause, perimenopause. What are your key messages about it that you think are really crucial for women to understand? And, how do you as a company and how do you as a woman help convey those messages?
Hmm. I think one of the main messages, which we also see from our community, is to get informed early and really get ahead of the game. And I think we once talked about Elizabeth. I think that perimenopause can be such a, if you're in your late 20s, early 30s, it's such an uninteresting conversation, or so you think, but it should be something, which it doesn't mean that you have to deal with it right away, but knowledge really is power. A woman in our community once described perimenopause as like her body is a room which all of
Her body is a room. Please don't say you froze. Is everybody frozen or just?
way of preparing yourself for it
Okay,
is so
Laura, hold on
important.
1 second. You froze for a minute. You said her body is a room. Can you go back? Because this sounds interesting.
Oh, sorry. You guys also froze. I was like, is this me or is this you? Am I back now? You can, yeah. A woman in our community once described perimenopause as if her body is a room where all of a sudden the light goes off and it's pitch dark. And she used to know where to navigate and where the light switch is and what to do. And all of a sudden, she has no idea anymore, where to turn the light on, where the table is standing, where the windows are, because everything is so different, because the symptoms are just so overwhelming and, don't allow her to understand how to navigate it. And that's Perry's key message is get ahead of the game early, even if you don't think it's relevant for you yet. So try to inform yourself early enough, just like we do with other topics in our life. Like if we choose to become a parent, we read books about pregnancy before we're pregnant. And my wish is that we do the same for perimenopause. And then when you're in it, that is our next mission, is really, find the right practitioner. I mean, we have great ones here in the conversation. It's okay to break up with your practitioner. It's okay to break up with your OBGYN if he or she is not serving you anymore. There's such a huge knowledge gap, you can demand the right questions. You don't need to, be the good girl in the practice talk. So that is really for us the two things we try to champion, like get ahead of the game early, and then when you're in it, you're feeling the first symptoms, try to advocate for yourself as much as you can.
Thank you for that. I think what might be also helpful, Laura, you had mentioned, I'd like to almost highlight this for a minute, that you were literally postpartum and perimenopause hit at the same time. Can you talk a little bit more? Because in this messaging, I think it's great to get ahead of it. But what has been really enlightening to me, I have two daughters. And so I think about the daughters and and my daughter, my eldest just had a baby, and that technically soon enough she'd be coming out of postpartum going into peri. So can you talk a little bit about that? Because I think it's worth highlighting and spending some time on that.
Yeah, I think and I'm sure everybody here as well will agree with me. I think how we grew up with the thought of perimenopause, menopause is like in these compartments, like you're in your fertility years, and then many years nothing happens, and then you're in menopause, right? At least it always how it was in my head, like these compartment in lives which are very clearly defined. And what we're not prepared for is this gray zone of, being that, so being postpartum and that. I think that is not anything my doctor ever told me. It was always like, you do this now, you're pregnant now, you're postpartum now, and then many years from now, at one point when you're an old grandmother, it's going to be menopause. But I find this blurry phase also for your daughter. There's so much misunderstanding of, what is that blurry phase? We often also associate perimenopause with infertility, and I'm pretty sure I got pregnant already when I was also in perimenopause. So I find this, this overlap super important. All my friends were all beginning 40s. When I talk with them about my work, they're all like, "Oh, but I experienced that. Like my sleep is, disrupted. I have that." But everybody dismisses it because they think, but I still have my period. So it all becomes very blurry. And I think I also see Jackie often doing this type of work of really educating that this is, it is blurry, but we need to be still aware of, it can happen simultaneously.
So I was going to move. I really appreciate that. And I think because you just mentioned Jackie, maybe we'll get into the question, but maybe you can continue on this a little, because I think it's really helpful for all of us to know, because it's, again, these stories that we pass along and pass down. You might see someone, I'm looking at Dr. Tracee, you might see someone in your community or who has a daughter who might be going through it. And it just gives you that extra, hey, it didn't occur to me. So maybe now it occurs to you. So do you want to, speak about that a little more, Jackie, before we go to the next question?
Yeah, I mean, just briefly, I think that that's so important to say that there's this overlap that you can get pregnant in perimenopause. But I think it starts even before that. And I think that, we teach young girls about puberty, but really it's just a talk about how not to get pregnant when you don't want to be and how not to get an STD or an STI. And then oftentimes, and there's nothing wrong with birth control pills, but we often put women on birth control pills for many, many decades for things like endometriosis or PCOS or acne or just for contraception. And they stay on that method of hormonal replacement essentially for many, many decades. And while that's amazing as far as not getting pregnant, what it does is sort of let women forget about what their hormones are and what they do and how they feel in their body, sometimes for a really long time. And then you come off your pill and then you get pregnant and you have a kid, and that's a whole different thing, right? You're just consumed with all having the baby and your hormones are up and down, but you kind of just chalk that up to being pregnant, and we expect that. And then you fall from that into perimenopause. And now we're expecting women with no point of reference, no framework for understanding, no prior education to correlate symptoms and cycles and know when your estrogen is high, it means this, and your testosterone is low, it means that. And it's just this really unfair place that I think we've set women up for. And no wonder that they're out there looking for this kind of information wherever they can get it. And so if we think about the continuity of women's reproductive health, starting at a very young age, normalizing this conversation, teaching women about their bodies, and move from that, I think we would see far less panic in the perimenopause transition. Women would feel prepared. They'd feel like they have the ability to take the proactive steps they need to take. And this again, this confluence, women are having kids later in life, and we're generally seeing perimenopause happen earlier. And there's a lot of reasons for that. And so we need to do a better job of preparing women for that.
Well, thank you for that. I think that that's so insightful. And, I'm inclined, we will get to your next question, but I do want to take this a little further because your next question is about sexual health. You looking at the whole experience, I think, is very interesting for women. And I think that as we look at, and I'm having a little bit of a moment because I had the perfect question in my mind and I'm like losing it for a second. But hearing you describe that, I think what's interesting is that a lot of OBGYNs haven't been trained to even think this way. And I've had so many conversations with different, both physicians and women going through different experiences. Laura, I think you said, don't be afraid to break up with your healthcare provider if it's no longer a good fit. But I think more importantly, and Laura, I also know, maybe we'll get back to, is you've created the Peri Academy to educate physicians at this life stage. But Jackie, talk a little bit about that because you are really unusual. And one of the reasons why I was like, you need to come into our Women's Health Expert Council because you know so much across the entire continuum. And that's unusual.
Yeah, I mean, starting in women's sexual health, that is actually not exclusive. I see patients who are 19 and who are 79. And I enjoy, meeting them where they are, wherever they are. But yeah, no, I think that this is, we've really boiled down women's health to reproductive health, right? And when your OBGYN is responsible for delivering your babies and doing surgery, and then we're asking her to essentially turn into, or him to turn into a primary care doctor for the next 40 years of your life, it's just asking a lot of one type of physician. And we don't do that to any other specialists or specialties of medicine. And so in the system is set up, certainly, we're also not set up from a from a societal perspective and reimbursements for this type of care. We haven't valued it and therefore we haven't paid for it. And so women are stuck with these 7-minute visits talking about all of their perimenopause concerns, and it's just not fair to the patient. It's not fair to the providers who are caring for them. We didn't learn this in school. It was removed from medical education as a result of the WHI. We decided we weren't going to prescribe hormones anymore. I'm sure you guys have all heard about it, the 20-year study that changed everything. And so literally they just removed it from education. So those providers out there now who you are seeing advocate on social media and in forums like this, we've all gone back to our own schools and gotten the certifications and done the research and practiced this medicine and sought out mentorship and take a personal and professional interest in it. And it's not always, you can break up with your provider if that's not something. They should just be honest with you, and be like, that's just not something that I know a lot about, but here's a really great option for some. And that to me is very fair, right? We can't expect everybody to know this.
Thank you for that. So I'm going to go now into the question I was going to ask you, and then we'll move to Dr. Tracee. So, back to the whole healthy sex life, how can women maintain a healthy one as they go through the perimenopause, and I'm adding menopause, through perimenopause and menopause?
Yeah, I mean, I think one of the biggest myths about women's sexual health in midlife or at all is that we need to have desire in order to have good sex. And women's sexual health is actually, it starts with arousal. Men get to have spontaneous desire, meaning that they get to just the thought floats, the wind blows left, the thought flows into their head, and boom, game on. And women actually have to put themselves in a situation to have a physical response to a sexual stimulus, and then their brain turns on. And when we have phones in our hands at all times and kids in the other room and your Slack channels are going off, like who's going to turn all that noise off and put you in the situation? So it needs to actually be an intentional choice that you make, and that can feel really hard. So finding ways to sort of lower that barrier to entry, I think is really important. Knowing what turns you on, knowing what feels good in your body. Your body might be changing quite a bit, and the things that felt good when you were 22 may not feel good when you're 52. I mean, I have to like say a lot in a short period of time here. There's, vaginal estrogen for everybody, seatbelts and sunscreen and vaginal estrogen for life. Like that's the mantra. It definitely helps bring blood flow, helps optimize the nervous system so you can experience good pleasure. Yeah, and then I think assessing your hormonal health, making sure you're filling up your buckets of testosterone and estrogen and progesterone, making sure you're sleeping, being open-minded, being curious to new experiences, communicating with your partner is really, really important. It's really something we don't do enough of. We just expect we're both going to show up at the party and we're just going to know what each other wants all the time. And we haven't learned the language, I think, to communicate about, where our insecurities are. So there's a lot that goes into this, but I think starting with knowing your body and spending time with just yourself. Solo sex is just as important as partnered sex. And there's more than one way to have sex, right? It's not all about penetrative sex. Like having an orgasm with oral sex or any other way is just as good of an orgasm. Like it's not less orgasm if you're not having penetrative sex. So there's a lot of biopsychosocial factors, but if you're interested in learning more about this, there's a lot of great resources. There's a lot of great books out there. It's actually it's a pretty interesting field of medicine that really I've enjoyed learning a lot about. And again, we have very few pleasures in life. There's not a lot of pleasure that's free, and sex is free, and so we should take advantage of it.
I love that. And I really appreciate the psychosocial thinking around it. I think, again, I go back to what I said earlier, is just this is a taboo sort of topic or uncomfortable topic to talk about in groups like this. And I think the way you just were able to sort of chunk it out, make it parse it out in such a way that it's easy to both digest, understand, and not feel like uncomfortable, because it's intimate, it's personal, right? So thank you for that. Dr. Tracee, I love this question because it's all about strategies. What strategies do you recommend for women to maintain their mental health during the transitions of midlife and perimenopause? And I don't know if it should be perimenopause and midlife. I might have that ordered wrong.
I think it probably all loops in together. So the first thing I would say, and this is what I say to anybody in any type of setting, right, is first acknowledge what's happening. And that seems very basic and very simple, but it's so challenging because we are so quick to autocorrect that, oh no, my sleep is just because I've worked too many hours, or oh no, I'm sweating just because it's hot in here, or oh no, I'm irritable because the man cut me off at the grocery store. No, acknowledge that, hey, something's going on here and something needs to change. The second piece, which also sounds very simple, but can be very challenging, is check in with yourself and see what you need. All right, this is where I am. This is what's going on with me mentally, physically, emotionally, and these are the things that I need. That may mean lifestyle changes, right? It may mean, okay, maybe we need more physical activity. Maybe we need changes in our diet. Maybe we need stress reduction. Maybe we need to make a job change. Maybe we need to have some tough conversations with family members about some lifestyle things that need to change. So checking in with yourself, what do I need? Seeking professional help. Talk to your gynecologist. And I love to break up with them. If they're not listening to you, if your gynecologist is telling you this is just part of getting older and deal with it, break up with them. They're not the right one. Find a provider that listens to you. They may not always agree with you. Okay, let's be clear about that. But you want someone that's listening to you, that's valuing you, and is telling you, hey, I'm on this journey with you. We are going to help get you to where you need to be. Talk to your gynecologist. Find a mental health provider, a psychiatrist, a therapist. Depression and anxiety in the perimenopausal and midlife space are real. Treatment can help. Treatment is extraordinarily helpful. And again, just kind of figuring out, and again, this is the cool part about this phase of life, you get to determine what it is you need and start to put those pieces in place to help this last third half, however many years we have left, be the best years that they can be. So that would kind of be the strategy. That's the strategy I've been trying to use.
I love
That's the
that.
strategy I've been telling friends and family, and that's the strategy that I tell my patients and the women that I work with.
That's great. Thank you. I think it's really helpful. And I think, this is like kind of this question really delved into the mental health of perimenopause. I mean, Laura mentioned it, and it was mentioned topically. Superwoman syndrome is a different thing, but really thinking about these life transitions and perimenopause and your mental health at this phase, when you are feeling overwhelmed, you are having all these sensations, is not. I love the acknowledgement and really honoring that and doing something about it. You know, making sure to do something about it. So thank you for that. Sharma, how do you, and I love this question because it gets into the cultural attitudes. How do you think different cultural attitudes towards perimenopause affect women's experiences?
No, I think that's a great question. Like, even if I speak about my family, like growing up knowing nothing about it, like even about menstruation, it was always considered taboo. Even if you look at sort of the epic stories, like women, when they were menstruating, they were asked to sort of be alone in a room, separate from everybody else, till their menstrual cycle finished, and then they could join the rest of the world, right? So I think culturally, those are embedded in our psyches, where we don't talk about pain, we don't talk about what's happening, we don't talk about medication, we don't talk about getting information or even asking our doctors for those information. Even when I hit perimenopause, it's like both my doctor and my therapist, like they didn't know what was happening. They couldn't name it. And their solution was like sedatives, right? And I knew that's sort of a classic response to women in distress, right? Like, let's just give them sedatives. And this is also the part of like the menopausal crone, a woman who's kind of lost her mental balance. Clearly we have, but that doesn't mean that, we are beyond sort of help, if only people were sort of paying attention to what that help looks like. So for me, really sort of rejecting that first and foremost, and primarily because for me, it's not about dulling the symptoms, right? It's also about still feeling alive so that you can address what that problem is, right? Being aligned with what you're feeling, why you're feeling it, questioning it, asking the right questions. So I think really dealing with culture as a whole, where even there is no term for perimenopause, there is no term for menopause, and women experience through it, go through it, but nobody ever sort of, they don't think to ask the questions. They don't think that somehow there'll be an answer to it. Again, the normalization of suffering, right? Like it's the deal for every woman in the culture that I grew up in. So I feel like just thinking around, my particular offering, which is Kriya, thinking about how topically and in that way really help women reach a certain level of calmness, which may then lead to better decision making in everyday life, right? Like asking the questions, you have to get to a place to start asking those questions. And then secondly, I think through this project, which I've identified as aloneness, like how do you side with yourself, pay attention, create that sort of precision in listening to your own body, whether it's creating a metabolic precision or it's creating really ways of eating, that heals you from the inside out. And also once you're physiologically powerful, you start to emotionally feel well as well. Yeah.
I love that. It really resonates with me on so many levels. I like the cultural reference and conversation around the taboo topics. I think that, like across cultures, one would argue that perimenopause was never a thing, so we didn't know it existed. We went through all these different things in those phases pre menopause, all these symptoms. I mean, autoimmune diseases, what have you. There was no correlation to anything. I think it's really helpful now to be able to attach it and give it a name, perimenopause, and then create awareness around it with companies like Peri and all the different companies. I think that's great. I'm going to hand it over. So thank you, everybody. This has been a really, really robust conversation. on so many levels, on the psychosocial and, the physical. I think it's just amazing what all of you bring. I'm going to hand it over to Amy, who is our programming and project management at under the Sisterhood. And we would love to open it up for questions. So if anyone has questions, and if not, I have one additional one, but I'm hoping, because we have been running these for an hour and a half, and we know that people, from a time perspective, we want to be mindful. But I do want to open it up because we have amazing speakers here who will have some.
Well, I asked one in the chat that I didn't get an answer to, which is why are we special? I mean, don't men go through the same thing? They go through hormonal shifts. Like, why is this such a big deal for us? It happens to men too. How is it different? How is it special? Is ours more dramatic and theirs is more gradual? Ours is more sudden? What's the difference?
Happy to answer. Yeah, it's the precipitousness with which we experience these hormonal changes. Men do go through what's called, sorry if I'm freezing, men do go through what's called andropause, which is the female version of menopause, but it is a very gradual decline in their testosterone. And we've been very comfortable with the concept for many, many decades of testosterone therapy for men. Urologists have been educated in it. It's not a stigmatized hormone for them. There was no study that, that made everybody just like, not learn about testosterone for men for 2 straight decades. And so it's partly that. Men's testosterone as well. Like if you look at a 70-year-old man and a 70-year-old like woman and his wife, let's say, in this example, and she's not using hormone therapy, and neither is he, and they're just, getting old together. He has more estrogen in his body than she does. And that is because his testosterone gets converted into estrogen, and that protects him. And it's one of the reasons we believe that women are 2/3 as likely to get Alzheimer's dementia, because men are lucky enough to experience the continuation of estrogen through until they're gone. And for women, the loss of their reproductive hormones and ovarian aging is a massive inflection point for chronic disease. And so when we don't take that seriously, we're saying that we really don't care about heart disease, osteoporosis, and dementia in women. So it's I think more of a wake-up call that like this is something that deserves attention, deserves understanding and a different approach, and we're not just small men. And so I think it's the gradualness of it, but it's also the gravity of it.
And can I dovetail that from an environmental and kind of a societal perspective? I think that our society is set up to accommodate for those changes in men, and it's just kind of woven in. Whereas, we know the reasons, society has not been designed in such a way to accommodate the changes that are happening in women. So it feels a lot more jarring because society's not kind of putting spaces in place for those changes to happen. I suspect that as we start to go through this and generational changes are occurring, those things will be happening. But I suspect that's why it feels, not only biologically, that it is more dramatic, it also feels from a societal perspective more dramatic.
Right. And we pay for men's healthcare and we don't pay for women's healthcare, right? There's reimbursements that are markedly different for the two. So I think that's part of it as well.
Any other questions?
Hold on. Excuse me. I have a comment. Hey, this is Lata. I'm walking, so I'm just going to keep my camera off. I think there was multiple reasons that were already cited, but one of the main ones is also the burden of healthcare and the cost of healthcare for women that live long and yet have all of these autoimmune and neurologic issues or decline at a certain age. And so there is significant emphasis on learning about this and also finding remedies or treatments from the time of postpartum as we learn in terms of how can we regulate the hormones, and how can we improve the autoimmune or the immune aspects of it. One plug I wanted to put in is that we haven't really fully understood, and I know I've shared this with you on a personal note, Elizabeth, on what the hormones actually do to our gut health and how that actually has an impact on immunologic disorders, because we know that they're all linked. And I think Ms. Giannelli just mentioned that women are not small men, and this hasn't been studied. And most of the studies that have been done for medications and treatments have been studied in mice who do not go through menopause, who do not have periods. And so we haven't been really tested in the real sense of a body that's similar to our biologic needs.
I want to piggyback. Thank you for that, Latha. I think that's amazing. I want to piggyback on to what you just said from an autoimmune perspective, because when I was like in my 40s, I got a spontaneous autoimmune disease. Spoke to that, and it was directly tied probably to my gut health. I mean, I changed everything. I did go on medication for 18 months, but it was really scary. And that was when I was going through perimenopause without the name. So I was literally going through and had the symptoms, and then got this spontaneous Graves' disease. And so I think gut health is an interesting thing. And, you know, Shubhra, I think you pointed out that what you put in your body, you know, it's like working on the inside. So it's interesting. I did have one, because we have a few more minutes, but I do have one question that I'll put out there, who, if anyone wants to answer this, you know, what changes or advancements do you hope to see in the discussion and treatment of perimenopause in the coming years?
I think at least in my culture, just for women to start talking about it, like even to say like, I'm in pain, I don't understand, right? This thing of like, no, it's nothing. Like I think Dr. Tracee said that, no, it's nothing, yeah, I might just be sweating too much because I was in the kitchen for that long. Or the fact that, oh my goodness, my shoulder's just frozen, like I must have picked something the wrong way, right? There's so much more to that, and to start really thinking through the layers of that suffering. And I think my job becomes one of really laying those layers bare, right? Saying that this all starts here and now we can sort of track it. So maybe I'll sort of develop an app way for women to sort of articulate this, especially in the South Asian cultures where there's such silence, which I think is deadly.
Thank you for that. That's really interesting. Any, Laura, Jackie, Tracee, Dr. Tracee, do you have any thoughts on this? What changes or advancements do you hope to see in the discussion and treatment of perimenopause in the coming years? I mean, Laura, you're marching Washington, so.
I mean, I think, of course, we would love to, have pharmacological interventions that would help mitigate the symptoms that people are experiencing. So I think that that's, of course, the medical answer to give. But I love the answer of, like Shubhra said, more people talking about it, that it's happening. It's nuanced, it's different, it's unique, but it's normal. It's not an illness, it's not an abnormality. This is a normal transition in life, and we should be able to honor it, hold space for it, and accommodate for it.
Great.
Yeah, and I think what is really important is that, and that's also something we're trying to solve with Peri Academy by really training not only MDs and prescribing physicians, but also allied health professionals such as pelvic floor specialists or psychologists or social workers or dietitians. I think that perimenopause should really be like a whole person experience and also a whole person support system. I often witness that perimenopause care can be quite siloed. Healthcare professionals don't always, and like Jackie was saying, it's not always malintent, but also, time and just, time and focus. And it's not always, the communication is not always there so much in the healthcare teams. So that's kind of my vision or my, aim with Peri and Peri Academy as well, like how can we bring more health professions into the equation of really supporting women, because it needs, the toolbox needs to be a bit wider than it is right now.
You know what just occurred to me as you said that, Laura, I'm sorry, I don't mean to point at you, but what occurred to me is this, if young women, if women in their 30s, mid 30s, start taking care and really understand. And I think you talked about understanding that it might not be the conversation you want to be having, but the more you know, in a way, you set up so much prevention, like the modalities you can put into place to having a longer life. Jackie, I'm sure that you can speak to this better than I can, but it just occurred to me as you're saying this, it's like it would be so helpful to I keep thinking next generation. As I said, I have daughters, but I think that it's something that we can hand down. Now, we know that the younger generations are much more socially conscious, maybe more aware of their bodies, maybe more comfortable having the libido conversation. However, are they as comfortable with having this conversation in terms of whole person?
That was where I was going with it, Elizabeth. And the answer to that is they are. I was born in 1980, and so I'm like part millennial, part Gen X, and kind of, in my care, I play up and I play down, and I can tell you that, the women who are coming up, this next generation, they approach their pregnancy and their fertility and their postpartum journeys very, very differently. They're going out and they're seeking the pelvic floor PTs, and it's changing rapidly. And I think with this cultural zeitgeist around perimenopause and all this, they're hearing all of it and they are showing up way before symptoms are starting and asking for proactive care. And that was my sort of what I hope to see. And I think we are, is this shift from reactive menopause care, waiting for someone to have chronic disease, waiting for someone to have moderate to severe hot flashes before we offer solutions, and really being ahead of the curve. I think that's something I'm excited about. And I think what will speed up that solutioning is new data sets, right? New companies throwing their hats in the ring, like Aura Ring, like tracking, like understanding symptoms in cycles and doing more research, more funding. The Melinda Gates Foundation just put a bunch of money in women's health, right? So here we are, like, with this opportunity to invest in research and in data, and then combining that with the power of AI to give people real precision medicine focused solutions, because my perimenopause is very different than the perimenopause that you went through, Elizabeth, and everyone kind of deserves a bespoke, curated treatment plan, and that's very hard for your regular gynecologist to achieve, again, in 7 minutes. So I think that the power back to the consumer to advocate, to do a lot of this stuff outside of the doctor's office, is where I see this going.
Awesome. I think that's thank you for that. I think that's very enlightening. And so, yeah, it's in our hands. And I think, back to, and I'm looking at EJ Kim. I know that I can't see your face, but you made the comment yesterday. If I knew then what I know now, the things we could do differently through perimenopause and everything to ensure strong bone health, all of the things that we're going to encounter later in life, I'd be doing that. And so thank you all I don't know if anybody has any more. I want to give back time, but if anybody has any questions they'd like to ask.
I actually am a little curious what the panel would say too. I'm 47. I felt my body change biologically at 45. I felt some things just different. I'm also aware of this time in life brings some natural changes that come to mind. Of some women are dealing with maybe career change because they've been unhappy with something that they've been in for 20 years, and they're coming to terms with that, and they're not willing to continue on with, the BS of life because they've experienced enough, and they are feeling more called to that than to people please. Or they have kids. I know several women that are dealing with their kids going off to college, and they're empty nesting. And so what would you say is the difference between these biological issues that are just natural and going to happen, and the actual just natural process of life, that when you go through different decades, we're going through different things? And is there a label for that, or do we have to is it part of the perimenopause phase in a way, or is it like some things are just the cycle of life that we're going through in a modern society.
Yeah, it's all of that. It's all tied in together. It's all this beautiful, complicated, gobbledygooky picture that's happening. And each one influences the other. The hormonal changes are influencing life decisions. Life decisions are influencing our bodies. It's all just woven in there together. And it's hard to tease it apart. And I don't even know if we should be teasing it apart, because what that does is it makes a false distinction, like it's not all impacting each other. And again, the first, whenever I work with women that are in their early 30s and they're realizing, oh my gosh, I don't know anything about life and it's really scary, and what do I do now? I always tell them, don't worry, when you get to your 40s, you still won't know what's going on, but you'll feel much more comfortable about it, right? Because that's what happens when you get to this phase. And we do start saying, I don't want to put up with that stuff that I used to put up with. Maybe it's just because I don't have the mental energy because my estrogen levels are dropping, I'm not getting a lot of sleep. Or maybe it's just because I've walked the earth for 40 some odd years and I just ain't doing it no more. Either way, if for me, it all ties in together. And I'm sure the other panelists probably can say this far more eloquently than I can right now. But that's kind of how I view that.
That's great. Anila, I don't know, Amy, if you say hi, Anila. Anila's from Pakistan, so you're up at some. I don't know what hour it is there, but I want to.
This is hi. This is 3 a.m. in the morning, by the way, 3:19 a.m. in the morning. So when I read the topic about the menopause, I wanted to maybe ask for, because this is always in our mind, because me being neurodivergent, you, Elizabeth, being neurodivergent, there's something always different about the women who have neurodivergent brain, let's say, or let's say neurodivergent body. So puberty is hitting them very differently, like their puberty is coming before the usual people around the world, and I'm talking about girls and boys. So, and same is true for pre-menopause and menopause as well. So like you ladies, whoever is sitting over here, because it's not the discussion in the Pakistan that I asked over here somebody as a neurodivergent woman how your menopause is. But I would like to ask these questions from you, because in your region, these discussions are very open. And they're talking about that. They're talking about the researches which they are doing, and they're talking about the mental health that is attached to that. So anybody want to uh, give something, or maybe a view, or maybe what you could say idea, that if anybody of you knew how your menopause or pre-menopause was, because again, we are going to that age, right? I'm not of that age, but going to that age. And uh, when I was having puberty, and I think many girls that I'm working with, when they're hitting their puberty, there are a lot of gender dysphoria involved in that. Body dysmorphic disorders are involved in that. Uh, a lot of eating disorders are involved in that, and we have this acne and poor acne in our body, a lot of going around, and we just don't want to be girl anymore. So I would like to ask you people that how you're going through that, or how you're dealing that, or what we can do about that, how to get that support.
Thank you. Laura, are you answering it? I don't know if you're on a call. We can't. Okay. Does anybody want to take Anila's?
So it sounded like a very broad question, and I'm trying to, in my mind, kind of can narrow it down to like, okay, what piece of that can I speak to? Because I was hearing a lot of pieces. How do we help not just kind of women in this phase as they're navigating through this in different cultures in different parts of the world with different I love the neurodivergence piece, because that does add not an extra, but a different element to it. And how do we help women go through that in the perimenopausal space? But then, of course, we're talking about younger women in puberty. So I don't actually have an answer to your question other than to say it opened up a whole new world in my mind about what are we doing to help women navigate through, again, what is a natural part of life, but is also very different for everyone, and it does have a cultural implication to it, right? The perimenopausal years absolutely have a cultural implication to it. It is different depending on how we're processing things with the world and how the world is engaging with us. And I don't know if maybe Laura and the Perry group have a better sense through the Perry Academy of how they're tackling that, especially since that is kind of an international group. But so I don't have an answer, but I think it's a fascinating question.
I actually have, Jackie, do you have something on this?
Yeah, I mean, you should speak to it, Elizabeth, also, but I do just want to say, yes, I mean, we can use the case example of ADHD and focus in in women and how underdiagnosed it is in women during the reproductive years, and then women, boom, hit perimenopause, and all of a sudden they, they can't find their words, their train of thought is missing, they become disorganized, they, the executive functioning skills, become challenging, and it's the impact of estrogen and testosterone. Each hormone has its like accompanying neuromodulator that it augments, and estrogen is a powerful serotonin modulator. So the reason we gave SSRIs to women for so many decades instead of estrogen was because we pulled estrogen off the market, right? And then we just had, SSRIs to give to women, when really a lot of women probably needed a combination of both in order to manage their mental health and their executive functioning. And so the approach, the diagnosis of these neurodivergent disorders often kind of bubbles up for us around the midlife transition. I would love to see more psychiatrists and more psychiatric professionals actually really like look into this area of medicine, because there's such a void in care. OBGYNs are not prepared to handle this. And some women's health, some therapists are, but again, they're not prescribers. And so women are really stuck. I don't know, Tracee, I'm sure you see this as well, but really stuck here with like navigating between these two worlds and trying to find help that meets them where they are. And this is just very disruptive to their professional lives, to their ability to be mothers or partners. And so I think there's a huge area of improvement here we can see. And what's your experience been, Elizabeth? But
I
curious.
think you kind of actually, Jackie, you kind of actually answered it. What I would leave it with, Anila, is that it's a tapestry. It's a tapestry. It's another layer to add. It makes things a little more complex. But you said what I was going to say, which is a lot of women are being diagnosed in their midlife with neurodiversity, with ADHD. So the confluence of things that are happening, back to the word confluence, is really something worth understanding. And of course, we don't know enough. But yeah, I know I'm going to hand it. I know that someone else had a question, Amy. I didn't, but thank you for that.
Was it EJ? EJ, do you have a question or something to add?
Hello. No, I don't have questions. Hey, Laura. Hey, Jackie. Familiar faces. No, I was just trying to, when you were talking about like, how do you understand the symptoms and then everything else that Amy, you're talking about, quitting my job, I'm going to do something else. How do I make sense of it all? And I think how I think about it, is that due to Perry? Maybe, maybe not. But I think Perry is such a long phase. So how I would just put it down like as a comment when we're talking about it, I'm trying to understand as we're just beyond our symptoms. So all of these things are happening as a phenomenon that maybe because of Perry, maybe not, but it's the sort of things that it's collectively that when we look at each other like, well, this is about the time that we're getting a bit more clarity. So oftentimes things that happen to us in midlife is described as crisis, but maybe it's not crisis, it's clarity. You're saying no more toxic relationship, no more things that I'm not aligned with my values. So goodbye with this career, I'm going to do something else, whatever the changes are. It's all the positive thing, but sometimes we put that spin like midlife crisis. I think bit of a media with the messaging that's not been serving us, frankly. But maybe it's clarity more than anything. So I just wanted to say that.
Thank you for that. I love it.
Ditto for syndrome. I mean, that word syndrome is like, don't get me started. I understand we're using it as a metaphor. I think it's a very sticky wicket, though, to casually refer to something as a syndrome.
Well, you know what my daughter would say? She would say, Mom, words create worlds. I have been living with that in my brain for now 5 years, trying to repattern, because I'm in postmenopause. I'm a little later than a number of you women. And I think I love being part of this conversation, because if we can help each other, if we can help all the women around us, each story we share and tell about our experiences helps the next woman know she's not alone. What she's experiencing is normal. Hey, and here's what you can ask your doctor. I mean, doing incredible interviews with all of you. And if you know of anyone who wants to share a story around their health or share a story around their mental wellness journey, I would love to interview them. I just want to say a huge words create worlds preach. Thank you, Lucia. A huge thank you to Laura, Jackie, Dr. Tracee, Shubhra, and Amy for today's conversation, and for all of you guys to join it, for joining it. It has been, I find it very enlightening, and it's interesting. I'm not in the life stage anymore, but again, I go back to if I knew what I knew now, then how helpful it could be. So I know for me, I have to start having this conversation with my daughter. So think about it as that for any of us who are in a position to be able to affect change. Speak to your friends, speak to your colleagues, speak to your neighbors, talk about it. And thank you, Laura, for doing the work to get Perimenopause Awareness Month up. Like whatever you were part of, it's a great thing. So thank you. Thank you all. Have a wonderful evening. 2 minutes back. We did good. Thank you.